We're here in the offices of Innovative Therapy Canada, and I'm David Murphy, joined by Lesley Paterson, the Scottish Rocket. Welcome.
Thank you.
And thank you for joining us in our little town of Cornwall, Ontario, Canada. First off, we'll give a little bit of history on yourself.
Yeah.
The fact that you're a world-class triathlete and you've won gold so far apart. Most athletes have a window where they're on their peak. Your window doesn't seem to be closing anytime soon, and it was here, and you won silver, but now you're back to winning gold again.
Yeah.
Congratulations. It's a decade
you.
of excellence for you.
Oh, I tell you, it's been a long and hard journey, but I think the resilience mentally has taken me through that path, and I was in such good form when I won back in 2011 and 2012, and kind of fell prey to illness, Lyme disease and various injuries. And I think when you go from the top to the bottom in literally months, you have so much fight and so much desire to get that back, and I think that's what's carried me through the last 6-7 years.
Well, and you talk about Lyme disease, and that's usually a career ender for most
Right.
people, or any type of significant disease or disorder that comes about.
Right.
You basically took that as a challenge that I'm going to
Yeah.
overcome this and I'm going to get back to where I was. What's the thought process behind that?
Oh, I'm Scottish, what can I tell you? Yeah, the underdog and all that. I think it was, again, just having that sensation of reaching the top and fulfilling all of my wildest dreams in terms of my ability, and going beyond that even, and becoming an athlete, or the athlete that I never thought I could be. I just wanted to get that back, and so the fight and the drive that got me there in the first place was the thing that has kept me going through all of the sort of bedridden times, and the depression, the anxiety, the pain, the this, the that, and at the end of the day, I sort of see my journey as a way to inspire other people. I coach a lot of athletes, and so, I think a lot of people are dealing with both chronic pain and illnesses that they don't know anything about, or issues or symptoms that they don't understand. And to educate myself, I'm hoping I can sort of inspire other people.
Well, for sure, definitely an inspiration. For the last 7 years, you've been dealing with the pain, and again, a lot of times, it's hard to go day to day with this kind of pain. You're not only going day to day,
Right.
you're a top flight athlete. You're one of the best in the world at what you do.
Right.
And how do you manage with the pain? How do you fight through it?
Gosh, it's, every day's a new day, and generally my pain is better in the morning, so I always kind of think at night it's going to be gone tomorrow. And it's just one of those things where the drive and the determination that's kept me going, or that got me to the top, is the thing that's kept me going. And it's been so hard to have the freedom to really push in sport and take my body and mind to that sort of capacity that you need to win when your body isn't right. So I think I just have this weird way of compartmentalizing. So breaking things down and saying, okay, well, I can swim without pain. Largely, I can bike without pain. It was always the running that was the issue. And the running was how I started the sport, and that was my sheer joy, was to go out on trails and run. And so that's been taken away for a long time. And I've just tried to find the joy in other places. And so I think just by breaking it down like that, and having a husband that's a sports psychologist has definitely helped,
Well, the therapy sessions would be easier.
Yeah, mind you, my poor husband's been through the ringer as well. Just the swings, the ups, the downs, and I can sort of have a day where I've largely not been in pain. Maybe training's gone really well, and I'm hyper, and then the next day it's crap, and I'm like, oh my goodness, and here we are from the highs to the lows. So yeah, he's definitely been my barometer, yeah.
How did you discover Cornwall? How did you discover Innovative Therapy Canada?
Yeah, so I think as someone that is dealing with chronic pain, you are the Google Meister. So I've just basically been obsessed with Googling symptoms, understanding my body, looking at different techniques and ways of trying to deal with this pain, trying to understand it and educate myself. So I've literally been to therapists all over the world, Europe, the US, Mexico, everywhere. And I've had so many different treatments, stem cell, PRP, ART, you name it, I have had it. And so I've kind of become a semi-expert, I think, in chronic pain. And so I managed to come about Glenn and innovative by Googling pudendal nerve issues, because that's a big thing. Pelvic issues is a huge part of Glenn's expertise. So that kind of popped up randomly one day, and just got on the website, and what he was talking about in his website really made sense. So I reached out, as I often have in the past, and never heard anything back. And next day I had a phone call from Glenn himself, and I'm like, wow, this is really cool. And called him back and sat on the phone for 45 minutes with him, and he was so gracious and so amazing, and what he said just absolutely struck home about what I was feeling, how to treat it, all of the knowledge that I'd gained previously. And all of a sudden this hope rose up in me again. Maybe it's possible to not have pain again. And so, yeah, I started to sort of figure out, how am I going to get to Canada, and how's that going to work? When am I going to fit it in my season? Because I needed some downtime. So Glenn and I, sort of kept in touch, email back and forth about things, and we sorted a date. And luckily, the triathlon community is incredible, both here in Cornwall but around the world. So I reached out to some of my Canadian friends that I race against and said, you don't happen to know anyone in Cornwall, do you, that I can stay with? That's like when people say to me, oh, my uncle's Scottish, do you know him? And I'm like, oh my God. But, some of my friends actually did. They reached out to the triathlon community, and lo and behold, we've had wonderful homestays. I've just been embraced by the community, so is my husband. And it's been a truly wonderful experience here.
We do have a very good triathlon community here, a
Yeah.
multi-sport community.
It's great.
And they encourage each other too. It's
Yes.
about competitiveness, but it's also about the community like you talk about.
Yep.
And that had to help as well. They're probably thrilled that a world-class athlete is discovering what they already know, the things that we do here in this
Right.
community.
Yeah, and I think they were sort of shocked about why I was here. And in fact, the first day we went into the NAV Centre, which is the local centre here in Cornwall, of course, and the gal on the desk was very, very nice, and she just kind of stood there and she said, oh, gosh, I'm so sorry, I'm kind of starstruck, I know who you are. So it was rather funny. She got out her book, because my husband and I have written a book together, and can you sign a copy? And that was kind of the start of the end, really. She called all her buddies, and then lo and behold, here we are. But yeah, it's been great.
Well, and talk about some of the therapies that have, now I'm going to read them just so I say them properly, but you're looking at contrasting oxygen, the altitude simulator, which
Right.
you had, the powerful magnetic field therapy as well,
Yep.
the shockwave therapy,
Yep.
and the trigenics.
Right.
How has that helped what you do? How has that been able to focus on your issues?
Right. So I think first and foremost, when you come and see Glenn, his ability to diagnose what's going on is unbelievable. I think because he's blind, he has such an innate sense of touch that is very different from anyone I've experienced before. But not only that, his personality, he is so driven, just like me. I think to overcome any sort of disability that he might have because he's blind, that he again has risen above many people that I've met. So his knowledge and his understanding of the body is amazing. So he'll put you through a sort of assessment, if you will, and really take his time. And he doesn't want to know any information first off, which is cool. So my husband came in the room because he's the biggest skeptic of them all, and Glenn sort of felt everything, touched everything, looked at my posture, looked at this, looked at that, and sort of sat me down and said, okay, you've got this, 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 and this going on. And I'm like, okay, that's everything. That's exactly right, which was cool because I've seen, as I say, the best physios, the best biomechanist in the world, and he's just in one sitting told me everything. I'm like, great. And then from that assessment, he then puts together a plan of attack, and he really talks you through it so you understand. So first and foremost, he puts you through sort of shockwave therapy. And what's really critical here, and this is something I didn't understand, is that not all shockwaves are created equal. Just like not all pieces of equipment, not all cars are created equal, and so on. The equipment he uses, you can't actually get in the US for a start. It's very powerful. You can only get it in Europe and Canada. There's only 7 machines, I think, in Canada. Glenn has 2 of them. And the way in which he uses the shockwave therapy as well in terms of his sense of touch. So his main thing there is to really break down all of the adhesions and scar tissue that have been created across the years of abuse and the Lyme disease for me. And realign your body, because what happens when things are wrong, like you have your crooked feet, you have your pelvis that's off, all of your biomechanics, all of your body, all of your posture is held together by all of these adhesions that have formed to kind of compensate and hold your body in this pattern. And no amount of massage or ART or acupuncture is going to break down that tissue, because it's so dense. And so Glenn then will get into all of these areas that he feels that have those adhesions to then essentially reset your body so that it can align itself. I've been given orthotics to kind of sort the feet, and almost like layers of an onion, right? Kind of peeling you back. So that's the first thing that he does that's very, very effective. And the oxygen therapy, the contrast therapy, the reason that that's really effective is it's about sort of detoxing the system, if you will. And what happens when, in the environment we're now in, with a lot of toxicity, me being an athlete, stressing my body, high levels of cortisol, diets, candida, Lyme disease, all of these things that are essentially impacting how your structures kind of come together, how you lay down scar tissue, all of these things. So the protocol of the oxygen contrast therapy, you're wearing a mask, and what happens is that you fill your system with 100% oxygen, so you're kind of super topped up with oxygen, and then you'll be doing your exercise. I was on the bike at a moderate level, and then you take away that oxygen, you reduce it to only 15%. So you're depriving your system and your tissues of oxygen, and you do that for so many minutes or seconds, and then you go back to flooding your system with oxygen. So you're going back and forth and contrasting your body so that your tissues can absorb a lot of oxygen and then deprive it, then absorb, then deprive, and it really allows the oxygen to get in and penetrate those tissues. And oxygen obviously can help with a lot of kind of chronic issues, a lot of bacteria, things like that. So yeah, it's quite an involved system, but it's really cool to go hand in hand with the shockwave.
And this is therapy in conditions that you haven't seen before.
No, I've never tried it before. So that was really exciting to me, because I feel like I've tried everything. So yeah, when Glenn showed me this, I'm like, wow, this is super cool, because you can do it on the treadmill. Mm-hmm. He has a lot of his non-athletic patients use it. They'll be walking on the treadmill. So yeah, there's a lot of different science out there about it. But I think where I've found the benefit is just, again, cleaning the body out. That's been one of the biggest things for me, and especially with Lyme, that's huge.
Well, exactly right. You talk about cleanse, that body cleanse, and
right.
that term's thrown around a lot, and a lot of people
right.
do it with food and drinks. But
right.
the therapy part of it, it's not only, like you said, the cleanse, but it's also the healing as well, because then
yes.
it allows you to move forward at the
right.
rate you were previously.
Right, exactly. And I think that's what most people don't understand, is that the reason that we get injured, there's a myriad of causes. And some of them are to do with health, to do with diet, to do with chronic illness as well. And I think if it comes together in a perfect storm, all of a sudden you have all of this inflammation, you have these adhesions, the scar tissue holding you in this pattern, creating these injuries, boom, you've got this chronic pain. So the other modality that he uses is pulsed electronic magnetic frequency. And I've tried this before, but again, Glenn has some great equipment here, real top-notch stuff, I'm talking $30,000, $40,000 per unit. And what it is, again, I don't know the exact science, so I don't want to butcher it, but you're using pulsed frequency to kind of help stimulate the tissues to build mitochondria, so the energy source of the tissue, to try and heal itself. It helps with inflammation, and obviously, as we know, a lot of chronic diseases and pain are caused by inflammation. So you sort of use all of these things together, and you're kind of really working on the cause of the injury and then the cause of the symptoms. And then the fourth thing that he does is trigenics, which is super interesting, and I've never had this either. And trigenics, we're focusing here on the nervous system. And what happens through your spinal cord is that when things are off kilter, they essentially stimulate the nervous system to overcompensate and tighten things up from a neurological perspective. So not a muscular perspective, a neurological perspective. So then things are almost hyper hypertonic or hypertense, and no amount of stretching is going to impact that, because it's actually a nerve-based thing. So Trigenics is where he does certain moves. We contract certain things. He uses different tools to establish points on the muscle to essentially release the nervous system in that area. And that's been wild. That's super, and that's a pretty easy thing. That's a maintenance thing he wants me to do, because it's not only about injury prevention, it's about maximizing my muscular potential coming back to the sport. So.
And to confirm, you've been all over the world for treatment.
Yep.
All this treatment is under one roof, whereas
That's unbelievable.
most places you've got to go to different areas, not
Yep.
cities, just different provinces, different
Yep.
countries to get some of this.
Oh yeah.
And it's all
And
here.
it's all
under one
here,
roof.
and it's all here, and you've got someone administering it that really understands the technology, has spent a lot of time researching it. But not only that, the science can often say one thing, and the practical experience in a clinical setting is different. So, you know, I live with a scientist, so he's again incredibly, you know, what's the word? Negative, not negative, critical of.
Very critical.
Very critical. But he does understand that there's anything from placebo to just a clinical setting, n equals 1. So, but again, it's about the practitioner. It's about Glenn. It's about how he understands the body and how he puts these pieces together. And that's not something you come across often. So yeah, and I've just been to so many people, you know, and I've come here and I feel like I've got this cool team, and it's not just Glenn, it's Lynn, who's his office manager, that's a sweetheart, you know, his wife Sherry, you know, you become part of a family. At least I have, you know. I've been here for 3 weeks, and I mean, even to the point where they've given me keys to the clinic and said, come in at the weekend and use it. I mean, how cool is that? So you understand that Glenn's greatest passion is to fix you. It's not to make money. And most clinics I've been to, it's to make money. It's thousands of dollars every time you bloody go. And you know, you just can't, you know, yeah.
There's a sense of genuine genuine care.
Oh yeah, definitely.
Of course.
You know, yeah.
Where do you go from here? Will we be seeing you again? I know you'll be speaking well about Cornwall and Glenn's clinic, Innovative Therapy Canada, but also, where do you go from here? What's your next level? Where do you go after all these gold medals? I'm guessing there's more competitions in the works.
Yeah. So I've had a little break, obviously, while being here, letting the body heal. So I need to get back to training. So I'll put in a good kind of 2. I'm actually going up to altitude in a place called Boulder in Colorado, which is pretty famous for triathlon. So I'll spend a few months there, let the body heal from this, build on the training, and Glenn and I will keep in touch with how things are going. And then I have the national and world championships towards the back end of the season, so September and October. See if I can defend those titles that I won last year. But most importantly, I'm going to find any excuse to come back. But you know what it is this is now my security blanket, which is a wonderful feeling, because when you're in chronic pain and your body isn't working the way you think it should be, you want to know that you have your hope, your savior that can come along and give you that help when things aren't working out. And I know Glenn's that person for me. So in fact, he might even hopefully come out to Hawaii and work on me before the World Championships. So
I got a feeling that's probably going to happen, because again, his commitment to the process. Right?
Yeah. Absolutely.
It's not about in and out and volume and just getting, you know, it's about the care. And we're saying this as 2 users. I'm not an employee, you're not an employee.
Right.
We both used Glenn's services, and the Innovative Therapy